Our next presenter is Dr. Julie Levy. Dr. Levy is the director of Maddie's Shelter Medicine Program at the University of Florida. Dr. Levy's research and clinical interests center on feline infectious diseases, neonatal kitten health, humane alternatives for cat population control, and immunocontraceptive vaccines for cats. She's the founder of Operation Catnip, with 2 university-based feral cat spay-neuter programs, and has been published in more than 100 journals and textbooks. She's quite a national authority, and we're delighted to have her here today.
Thank you. I've been thrilled with the presentations that have come before me, and they're just so inspiring, and I've learned a lot of tips to bring back to my own community. And I think that what we've heard expressed so far is how critically important good management is. That's where everything starts in the sheltering world, and I wish we could clone some of these good managers because I know how hard they are to find. We've also heard how proper housing and innovative solutions to the shelter facility are so important, and the critical importance of recognizing and meeting the behavioral and enrichment needs of our pets to keep them healthy while they're waiting for their good home are. And so I'd like to spend my time focusing on how a shelter medicine component of your sheltering program can also add to your life-saving goals. So in my former life, I was a specialist in internal medicine. I came to work in a university where I saw individual animals who were owned by people who would do anything to save them. Very often, the resources we needed were unlimited. These clients frequently would not put a financial cap on the care we could deliver, and we had MRIs and CT scans and dialysis and kidney transplants, and really everything that could possibly be used to save an animal we had. And so my responsibility in my former life as an internist was to bring together the brightest minds to focus on a single patient like this cat that has a team of doctors trying to save it. And now I work in shelter medicine, and this is a radical culture change for me because in veterinary school we didn't have any training specifically on treating groups of animals in small animal. That really was the focus of the large animal instructors, and at UC Davis we had tracking, so I didn't even take those courses. All I learned about was cats and dogs. And so now when I look at my practice, I say, who is my patient now? And certainly these unweaned orphan kittens are my patient, and the students are my trainees, but also the facility itself is my patient. I think of the shelter primarily as my patient now, and all of the other parts are the organs and bits that I need to deal with.